They don't pass through contact about like sneezing and then you find the STIs. So if you pass in the streets and sneeze, you can't contact these infections. Now treatment entails about what we call the 4 C's. The 4 C's. When I say the 4 C's, we mean number 1, the C, number 1 is about counseling. You need to counsel this person and tell him or her that this is just a simple sexual transmitted infection. It has cure, it can be treated. 2, on the second C is about compliance. Compliance, you telling this person about you're going to start the medication and what I need from you is to complete the dose. At times the drugs we give, some people just take it for 2 days and then they feel they're okay, they stop the medications on the way. So it's very important on treatment you emphasize on compliance. He or she should be able to complete the dose of the drugs given. The third C is about condom use. Condom use, you tell this person, now I'm going to treat you and from here you're going to do, if you have to do sexual intercourse, now use condom to avoid reinfection ama spreading further of this sexual transmitted infection. So you have to tell this person to use condom use. And the most important, the last C is about contact treatment. In contact treatment we say before anything else, he or she should bring all the sexual partners. At that moment some will come and tell you, mimi niko na bibi yangu peke yake. But if you go further and inquire, this person will tell you, niko na kampango wa kando, I have a lady outside. This doesn't mean if you test today positive, this infection was there yesterday. It's something that can be in months or in a month. So if you had a sexual contact a month ago, that becomes your sexual contact. And so it's important for you to treat that person. So once you come to doctor, we test you are positive of this gonorrhea, syphilis positive, then now we tell you, now bring your wife. You are married, you're not married, you are dating, bring your spouse, bring your fiance, bring the sexual partner, such that we cover them with drugs. Some might not present with any complaint, but by virtue of you finding the couple positive, it means this must be having that infection. So you don't forgo that. And necessarily you don't have to treat this other couple that these sexual contacts. You just treat them clinically with drugs. Yes.
So what are these drugs that you use to treat STIs?
Yes, some will tell you kwamba the commonest drug is an antibiotic. These antibiotics, they help to treat these infections, the gonorrhea, the syphilis, trichomoniasis, and the rest. And you have to understand the antibiotic course of treatment now is different. The some you can give for 5 days. For example, the commonest drugs used is doxycycline, 100 milligrams. We have azithromycin. The commonest around you can have azithromycin and doxycycline. But if you prefer injection, you can use ceftriaxone injections. They are available, they are easy to administer through IV. Yes, some patients will come and tell you they prefer injection than oral medications. You just have to give IV ceftriaxone 1 gram of either a BD dose twice daily, once daily for like 5 days, and you should be sure kwamba you've treated that infection. For the doxycycline, those people you give for 5 days course and you treat the infection, depending how long has this person been in this state with the infection. Those you give for 7 days, and some will go even 2 weeks, 14 days.
So, are there any proven home remedies for STIs?
So far, I don't think there are any. I have not seen any home remedies for this because as you know, we're moving away from the home remedy things to drugs.
People, watu wanarudi to home remedies.
So the challenge, I know the challenge we have is very hard to find a man seek these services in the hospital. For a man to come that I have painful urination, lower back pains, lower abdominal pains, it's very rare. So it will tell you, before this person shows up to the facility for testing and treatment, he must have come into contact with several others, which make this infection difficult to treat. That's why we advise people, you don't have to treat this thing at home, because it's an infection and you're coming into contact with other sexual partners. So it's important for you to treat it with these antibiotics. There is that form of prevention. We have the ABCs, of which people nowadays are not so keen on. We say you abstain, you be faithful, then condom use, the ABCs. So if you cannot be faithful, you are advised to use condom. And when you use this condom, you sure you prevented these STIs. If you cannot be faithful, then you abstain. That's basically how we can prevent these STIs. Stick to your partner, be faithful to your partner, and then you can't have contact into these other infections. They don't pass through contact about like sneezing and then you find the STIs. So if you pass in the streets and sneeze, you can't contact these infections. You have to indulge yourself in sexual activities. And that's the moment you find this infection. So it's simple. You abstain till marriage, be faithful, ama use condom.
Memes zenye zinaenda around that mtu akienda kwa daktari and anapatikana na kaswende, you shout.
I don't think they are real in the first place, because we have what we call patient privacy. Even if you have malaria, I don't shout out that you have malaria. I don't have that professionalism in me if I'll be able to shout at you kwamba you have kaswende. Yes, the name itself sounds weird, of course. Now you can imagine now shouting at the patient, you have kaswende. Patient privacy is very core in treatment. That's why we have that consultation room, and that's where I will talk to you about your health, and once it is done, it is done. You find it's not easy for a doctor you find him on the streets, he or she asks, Doctor, niko na shida gani? Then he now narrates your story on the streets. It's not advisable, because we say that's now privacy of the patient has been breached. Another patient might be able to know the diagnosis of another patient. Now that's not privacy.
Okay, what can you tell people wenye wanaogopa kuja hospitali when they present these symptoms?
I can tell you kwamba the Waswahili wanasema kwamba ukificha uchi hauzai. And you remember, I forgot to go through this. Kwamba these STIs, if left untreated, what happens? If you don't come to the hospital that you have this discharge, you say itaisha. Some will say, discharge ilikuwa ya kawaida, itaisha. What happens if you have these infections? Ama you have them recurrently? Because there are cases we have patients who have recurrent infections. You treat them today of this gonorrhea, after a week they come back with the same again, after a week. So that's the recurrency. And there are those who don't come for treatment, but they have this gonorrhea. They don't know they have gonorrhea, they have not come for medical advice. This infection, the most thing I know that happens is infertility. It is the cause of infertility in most people. So you find a lady at the age of 40, she tells you she has no child. Then you want to rule out the possible causes of infertility in this lady. Go back, ask about history of STI treatment in her past. How was the contact by then? If she has been treated before of these sexual transmitted infections. Mostly in a man will tell you if he or she started with this urethral discharge. He'll tell you nowadays my libido sexual drive is low. Yes, you get to understand what's going on, because with long-term exposure to this infection, for example syphilis or gonorrhea, he or she is gonna become infertile or impotent, that matter. So for a man, with time, he'll tell you, I no longer erect. So a man comes with issues about erectile dysfunction. He tells you, I don't erect. Purely, I don't erect. Then now you want to root the possible causes. You ask this person, have you had any contact? Have you presented with this and this in the past? Have you been treated of this and this? And then when you take that history keenly, you get to understand this person has had infection that has not been treated. So you start treatment at that moment. Then if he is lucky enough, it can be treated, and then now the erection comes back.
Yeah, thank you very much for the information. Thank you for getting at this point. I'm grateful that you're still here. Hit that subscribe button so that we may work together. Na kama venye umesikia, it's now hitting reality that mficha uchi hazai. Ukificha uchi that you do not want to get treated of STIs, you might never get to reproduce. So when you present these signs that we've talked about, get to a doctor, let you get treated together with the people whom you've been having sexual contact with, and let's keep an healthy environment for Kenyans to survive.